Welcome you all again to another interesting story session, another case study that I'm going to be narrating. This is about my experience with my patients who go through their own journey, and when they have their own desired outcome, successful outcome, it is not only so joyous for this couple, but then definitely it gives me an immense joy that I was part of their journey in making them helping them in achieving their real joy. Hey, hi, I'm Dr. Indu from Samrudh Fertility Urology Center, and today I'm going to be talking about another interesting case study that I tackled or I helped a couple. Male infertility as such is actually a very challenging issue, especially when the count is really low, because when the count is very low, then we know that the chances of pregnancy is extremely compromised, because in situations where the count is less than 1 million, you can imagine the agony that a couple goes through or the gentleman is going to go through. So now when it comes to male infertility, we all are aware that female infertility is something that people know, and what they go through. But when it comes to male infertility, less is spoken about that. Now, even for men, 1 in 10 men will face some or the other fertility challenge in their lifetime. But then, do we talk about it? No, we don't, because then when it is when it comes to female infertility, everyone attributes the infertility cause to be predominantly male. But then you should be aware of this fact that 30 to 50% of infertility is also because of the male factor. Now, when it comes to the treatment aspect, even men will have to go through their own challenges. It could be financial, physical, but then we talk very less about their psychological aspects. Even they go through their psychological issues. It could be feeling of anger, feeling of inadequacy, feeling very embarrassed. Now these things is affecting them psychologically also, but then men are generally not expressive. So is it affecting only the man here in the scenario? No, actually also affect the couple as such and their relationship. Today's story is all about this couple. This is a couple who had to go through the challenge of severe male factor infertility. It's all about when the count is lesser than 1 million, and according to the data, according to the statistics, when the count is so low, then we know that the probability of pregnancy is going to be really low, and that becomes very challenging for the couple, especially when they think that they want to achieve pregnancy only through their genetic material. Here, this couple who came to me 4 years back, the wife was around 31 years of age, the husband is around 37 years of age, and when you go through their history, you have to go through a thorough history, understand what is their challenge, then in detail the history is taken, and then assessments are done, examinations are done, investigations are done. Now, what was the finding here? Actually, what I came to know was that wife was on the heavier side, and she had some other challenges related to the gastritis, the acidity issues, for which she was going through a lot of Ayurvedic treatment, sometimes allopathic treatment, but then she was on the medication on and off. When it comes to husband's evaluation, husband had extremely low count, which was around 2 to 3 million per ml, and this is a very low count. And then definitely here in such a scenario, the natural conception is kind of ruled out, and they need only higher kind of a treatment. Along with this, the gentleman also had frank diabetes, which got diagnosed for the first time, and this was like a shock for him. So now, as a doctor, as a fertility expert, what is the next step? Do I jump and tell them no, count is low, and so you have to go ahead with the IVF? No, you have to first prepare. One needs to correct the problem that they are going through, isn't it? So the problem was of the weight for the woman. Also, she also had lower count of egg. That was also very distressing for the couple, because here not only obesity challenge that she's facing, but she's also facing the count of egg reserve being on the lower side, along with the husband count being very low. Now, in such a situation, what happens is Suppose you have 5 to 6 or 10 sperm available, but the number of egg also is compromised, then the overall outcome also gets severely compromised. In such situation, then a lot of talking goes. I talk to them and make them or sensitize them why losing weight is essential and why the gentleman having the sugar getting corrected or coming to the normalcy is extremely important. And you can sense it that this will take minimum of 2 to 3 months. Now, this was all during the corona time, and then they went away and they worked on themselves. The wife had the difficulty of losing weight because of her gastric issues. Husband was having a very good control in his sugars, and that was all stable. So they come back to me after 1 year. Again, the same tests are repeated because it was after a long time. Now, when the tests are done, husband count is again around 1 to 2 million per ml, which is really low. And but then the embryologists check the sperm and they say that this is really not that suitable for doing IVF. We may need to also keep the option of aspirating the sperm from the testis or the tube of the tube which is originating from the testis, where the sperm are stored generally. So all these options are given to such a couple in such a scenario of extremely severely low sperm count. Now, the other option of donor sperm is also discussed. See, it is very, very important. It is not a very easy decision for the couple to take, but it's really important for them to make aware that if this count is on the severely compromised side, then the embryos that are going to get formed will be compromised. The success rate is also going to be very, very less. Now, they would have to spend the same amount of money, but the success rate is going to be very less. So the other option of donor sperm is also discussed, so that they know how are they placed financially and are they ready to take it, or they want to stick to their choice of going ahead with the sperm, whatever sperm they get, and getting an IVF done. So the thorough counseling was given to this couple, and then they said that they are going to take the IVF treatment with our genetic material. So now the journey begins to start their IVF treatment. So the wife goes through the stimulation with a higher dose of injections, and she grows only around 6 to 7 follicles, and then she is ready for the egg pickup. So as all is discussed beforehand, the gentleman gives a sample. It is not adequate for those, we were not having enough of sperm which were really good to be used for doing the fertilization of the egg. So now here what happens, we actually a urologist did the PISA, that is aspirating of the sperm from the epididymis. It's a tube that carries the sperm, or the sperm is stored temporarily for a shorter period of time. So needling is done through into that tube, and sperm are aspirated. So luckily he got few motile sperm which was better than the ejaculate sample. And then the procedure of fertilization of the egg was conducted. So out of around 7 eggs, what happened was she got only around 2 embryos, but luckily she had both blastocyst embryos, and both were of reasonably good quality. Now this woman was very clear that she didn't want twins. So as she had 2 embryos, she said that, "Doctor, I'll take the transfer one by one." And this is what I also insist, that the woman should go through embryo transfer when the embryos are of good quality or decent quality, where she takes transfer one by one. So she had that embryo transfer in her fresh cycle, but unfortunately it did not result into a pregnancy. She wasn't not that disheartened. She said, "Doctor, I know I will conceive. I'm having all the hope." And she was ready to start another cycle immediately after that negative result. So now here what I did was that I told her that we will do a natural cycle monitoring of your menstrual cycle, and then do the placement of the embryo in that environment. So she goes through this process of monitoring, and finally the day of transferring the frozen embryo comes in a natural environment, and that is done. The embryo was on thawing, on taking out from the you know the it is frozen, so when it thaw, the embryo quality was really good, and that embryo was transferred back into the uterine cavity. So the result after 14 days, it comes as positive. So the woman, the couple are really very happy, and they were of this thought that if I had to, or I have to conceive, then let it be with our egg and sperm, and not anything else. So she was like so confident. So it gives us also a very, as a team, when we work for them, it gives us an immense joy that she could achieve that dream, or she could be successful in seeing her dream coming true. And then she goes through the phase of 9 months. She had a lot of vomiting issues in the beginning. Somehow she managed. We had to give her medications, and the rest of the journey, it was really smooth. She did not have BP, she did not have sugars, and at the end, actually, the baby, despite she having a problem of the vomiting and nausea feeling, she was not having a good amount of food. Despite that, the baby's growth was on the heavier side. So at around 37, 38 weeks, the baby was really big, and she was having a lesser movement. That is when it was decided that we go ahead and do the delivery. And she delivers a healthy baby at the end. And now the baby is around 8-9 months. And she is really super happy that what she thought and what she imagined, that she will have her own child, she could achieve her own pregnancy. So what I would like to say here is that male factor infertility definitely is very challenging, and when it comes to the success rate is definitely low. I would not say it is good. But then how do you come to know, or how do you know unless you try? So you have to try the treatment at the right time. Now how the chances get compromised is when the female partner is also having a very very low count. Then becomes challenging to achieve a successful outcome. But then at the end, it is only one egg that is needed to form a beautiful embryo. And in such a situation, the couples are also aware that when the sperm count is really low, then the chances of abortions are high. Despite all that, one must go through the treatment to understand whether the success is achieved or not. So I would say that you have to take the treatment at the right time, and don't delay, and don't keep spending time in going through lot of other miscellaneous treatment and wasting your time. So take the treatment at the right time, because one important thing that you have to note here is the count. If it is lower, it is not going to remain the same for 1 year, 2 years, 3 years. It is going to go down. Sometimes it is going down drastically, and then you would lose that time of having that good number of sperm for which could have been used for IVF ICSI procedure. So this we encounter that they go on taking some of the other treatment. Earlier it would have been around 4 to 5 million, and 2 to 3, 4 years pass by, and when they come to us, it is less than 1 million. So you see that your probability of achieving a pregnancy through IVF treatment also goes down drastically. So do not hesitate to take this treatment at the earliest, or do not delay it. This is what I would like to say. This should be clearly understood. So I hope this story is inspiring, and the commitment, or the confidence that the couple had in themselves really gave them that positive outcome. I did what was right for them, but their faith was immense, and she could achieve a pregnancy at the end. So that's such a I feel so blessed that I was part of their journey in bringing that joy in their life. So if this story resonates, if you feel that someone is sailing in the same boat, then do remember to share this story with them. Let them also go through this story and take action.